Hello everyone, my name is Albert Mansua. I'm a cataract surgeon and global vision specialist at Kenya Center for the Blind. So today I want us to talk about glaucoma. So glaucoma is a disease that usually affects the eye and mainly the optic nerve of the eye. It's called a syndrome because it has several other issues that is associated with it. And usually we call it the silent thief of sight. This is because as it presents, most patients do not understand that they might be having glaucoma. And so the only way people are able to be diagnosed to have glaucoma is through assessment of their eyes, and this is usually through a comprehensive assessment. In terms of the risk factors for someone who has glaucoma, so number one, it has been associated with people of the African race. And this is documented in most of the literature that we have out there. So if you're an African, then most likely you're already at risk of having glaucoma. Number two, age. People who are getting to the ages of above 40 years of age seem to be having a higher probability to develop glaucoma. The third risk factor, which is very, very important, is a family history of someone who has glaucoma, and the first degree family or relatives is highly associated with having glaucoma. And sometimes most people do not know that a family member had glaucoma. So we usually ask if there's anyone in the family who has either had a history of vision loss and it was never ever known why they lost their vision. The fourth one is comorbidities. Comorbidities are any other systemic conditions that someone might have. This is things like diabetes, hypertension, and these are usually associated with glaucoma most of the time. And lastly, if you have increased intraocular pressure. So our eyes usually have a normal intraocular pressure of anything below 21 or 11 to 21 as a range. So eye pressures that are higher than 21 are also associated with glaucoma. So sometimes people assume just having high eye pressures will definitely mean to have glaucoma, but some cases we have patients or clients who have normal intraocular pressures but still develop glaucoma. And so that's why it's considered to be a syndrome and not just one of a single diagnosis because of having high eye pressures. So what can you do to be able to either know that you have glaucoma and also to try and contain it? So we usually recommend that at least once in a year someone should have an eye checkup. And if you have the 4 risk factors that I mentioned earlier, then it's definitely necessary for you to be able to have this assessment. And usually recommend at least once a year checkup. And what happens in these checkups? Number one is we assess your visual acuity just to measure how far you're able to see clearly. Number two, we check your intraocular pressures just to see if they're within the normal range. Number three, if we suspect that your eye pressures are high, then we think of doing some diagnostic tests, and this includes visual field tests, which assesses how well you can be able to see your periphery, because glaucoma is a disease that usually affects your peripheral vision first and then constricts towards the center. So we're able to assess how well you're able to see the sides and up and down as you're looking straight forward. The other test that we can also do is an OCT test, which gives us an image of what's going on at the back of your eye and how healthy the optic nerve is, and also gives us an inclination of how much of a degree someone might be having in terms of glaucoma. And then we also do a dilated fundoscopy so that you can be able to visually assess the eye and look at the optic nerve to see if the blood vessels are looking healthy, if the nerve itself is looking healthy. So as Kenya Center for the Blind, we're able to do all these comprehensive tests just to see if you are a patient or a client who has glaucoma or is suspected to have glaucoma. And these tests that we're mentioning that you need to do at least once a year, or these reviews that you're talking about that you need to do once a year, are important because one, we need to monitor the progress of your glaucoma. Is it getting any worse, or is it damaging your nerve anymore? And then also that guides us in terms of the treatment option that we have for you. So that decides if we are going to give you medications, if you're a client who's going to benefit from laser therapy, or if you're a client who might need surgical intervention. So I'll urge all of us this month of January, being the Glaucoma Awareness Month, let's have our eyes checked. Let us be able to have our eyes assessed, and visit any eye facility close to you. For those who are able to come to Kenya Society for Blind, please, you're most welcome, and you can be able to assess and see how healthy your eyes. Thank you very much.